Hello guys. This is Annie's Feet, and I'm here with Dr. Peter again. The topic for today is menstrual cycle. I'll be passing the mic on to Dr. Peter now to explain to us what the menstrual cycle is. Dr. Peter.
Thank you very much for having me again. The menstrual cycle is a very broad subject, and it has to do with the hormonal changes that a woman who has attained puberty would have. And all this is to prepare the woman for pregnancy, or in the event that pregnancy does not occur, the changes that also happens as well. Averagely, the menstrual cycle is something that differs, from one woman to another. But averagely, it's 28 days. But then there is a period of 28 to 32 days, and for some women, it may be shorter than that. And then there are so many things too that can affect the menstrual cycle, such as stress, uh, malnourishment, and some problems that actually would disrupt this cycle. So there are so many things, but we can't mention all of them here. The menstrual cycle in itself is divided into different stages. The two most important are the follicular stage and the luteal stage. So the follicular stage is seen when there is development of the egg. So there is development of the egg, and this is driven by hormones. So hormones are like what we will call the chemical messengers that govern how certain functions would occur. So, like, there will be a particular time at the beginning of the menstrual cycle where a particular hormone called follicle stimulating hormone, let's just say egg stimulating hormone, would stimulate the ovary to start maturing that egg. Then, at the 14th day, or the day where ovulation is supposed to happen, another hormone called luteinizing hormone, let us just say this is the ovulation hormone, will spike on day 14 of this 28 day, which is 28 divided by 2,
Okay.
day 14.
Sorry, cut you
Mm,
short there.
yes,
You said something about the
luteinizing.
luteinizing. That
Mm,
luteinizing hormone, is
mm.
it the luteal phase in particular or what?
Okay, so the luteinizing hormone, it works side by side or hand in hand with follicle stimulating hormone. So let's look at it this way: in a 28-day cycle, let's just say after the last menstruation, then the womb begins another menstrual cycle. So now let's just say, like, from day 4, from that day 4, like it starts from day 1, so from day 4 there'll be development again. Then the follicle stimulating hormones it begins to rise. When it is rising, it is telling the ovary, produce more eggs, mature more eggs. So those eggs are being matured in the ovary. On day 14, luteinizing hormone, that is also slowly rising, will peak. It will just, there will be a spike. So that spike tells the ovary that has matured the egg through the help of follicle stimulating hormone to release that egg. So it is luteinizing hormone that causes the release of the egg. That now begins the luteal phase. So that will be from day 14, 15, 16. You will now have that luteal phase. When the egg is now produced, it will release itself into the fallopian tube, which are, let's just say, like the pipe that leads to the womb. So that egg will continue going there, for about maybe from day 1 of its release to about day 5 or day 7.
Okay.
Mhm.
But I have a question
Yeah.
at that point. That luteal phase now,
Mm.
like what are the symptoms or what can we experience during that luteal phase that we know, okay, this
Okay.
is the luteal phase we are
Mhm. Okay. So first of all, we have to look at from the phase where the woman ovulates, where she releases the egg due to the spike in that luteinizing hormone. So when the woman, sometimes ovulation comes as a slight pain in the woman. It could be on the left side, on the right side, depending on which ovary is releasing the egg that particular month. So this is what the Germans will call Mittelschmerz. Is a Mittelschmerz pain. We call it ovulatory pain. So usually during that luteal phase, there could be some slight mood changes. Here and there, there could be some slight mood changes. But although this doesn't actually happen in all women, yes. And then this can also be that change over time that may now lead to some women having premenstrual syndrome, but not all women will have it, or premenstrual symptoms that leads to a syndrome. A syndrome is like when you're having so many symptoms all together, but not all women have this. So I will not say okay that this is how we will know that woman is in the luteal phase, because a woman should know her menstrual cycle, how it is for her. Then we can also use that one to detect, some of those changes that the
Okay.
woman might have here and there.
Okay. But during this phase too, can the woman experience something like, is it this luteal phase that women experience something called bloating?
Yes, they may experience bloating and all, because we were still explaining the whole phase. So like, let's go back a little bit. So now we have said that from that day 4 to day 14, the egg is being matured, and then on day 14, ovulation takes place. We are using a normal menstrual cycle now, like ideally, but it's not the same in all women. So day 14, when that ovary releases that egg, due to the spike in luteinizing hormone, which causes ovulation to happen, the egg now enters the fallopian tube, waiting for sperm to come in. So now that space of the ovary that has released the egg, it will now be called corpus luteum, which is yellow body. Luteum means yellow, corpus means body. This corpus luteum now begins to produce another hormone called progesterone. Progesterone is the pregnancy hormone. What that progesterone does is that it tells the womb to prepare its lining for pregnancy. It's just like you telling somebody, go and lay the bed, prepare the room for somebody to enter. So while that egg is still making its way from the fallopian tube to the womb, the progesterone is already making the womb succulent. And what does it do? It produces a lot of blood vessels, makes it very spongy, so that by the time sperm meets that egg, the egg will implant very well, see nutrients to develop. And this can happen from the 14, 15, 16, 17, 18, 19, 20. Now, but then, like we have said, it's like 5 to 7 days, right? Now, after this particular time, I'm just making it general now. Let's say, like, after these 7 days or thereabout, if there is no sperm to fertilize the egg, progesterone drops. When it drops, that is what leads to menstruation. Menstruation is actually as a result of the fall in progesterone level, meaning the guest you were waiting for did not come. What do? You carry your bed sheets that you have used to design the old room, you throw it outside. You reverse, you don't throw them outside. So again, the body now starts another one. So this progesterone definitely is going to cause some symptoms as well. It's just like saying a woman is on a contraceptive pill that is like a progesterone like or estrogen like substance. It will cause some symptoms. So it differs in some women. So this is most likely the major reason why some women may feel some certain symptoms when during different phases of the menstrual cycle, because of these hormones. Now, when a woman is fertile, when she is ovulating, there would be some symptoms you would have. The breast becomes more sensitive. She wants to actually mate with her man more than when she is not, in this particular stage. So now this is the mating signal, because of course she's releasing eggs. It's a signal that might tell the man or her companion that okay, it is time for us to go and basbos. Those kind of things. So you have breast tenderness. You would have this feeling to to be closer to your significant other. There would even be what we call some pheromones. Pheromones are certain kind of signals, maybe from sweat glands. There will be some, some smell, yes, scent, that also is also being produced as well. And then you would also see that there's something we call the cervical mucus. There is a way to actually check if a woman is actually ready to copulate. So the cervical mucus will become thin rather than it becoming thick. This cervical mucus is the entry of the womb, the entry. So that is where the sperm is supposed to enter. So it is thin because it's now willing to allow sperm enter to also swim to the fallopian tube. So all those things are now ready. And of course, the woman is actually ready to copulate. And then the cervix becomes more receptive. It's not as short, and difficult. It becomes more receptive. So if all these things does not happen, menstruation is what follows next. So, and before all that, 2 weeks or a week before, some women can have premenstrual syndrome, which is, of course, you have the breast tenderness as well, headaches, pain, heat flushes, and all those things can be treated with pain medications, and reassurance and all of that.
Okay.
So these hormones, they play a big role in